We have just about 10 minutes left. I know some people need to get out of here promptly. Um, Mostly just as an opportunity for Dr. Feynman and Dr. Cicerone to offer some closing thoughts based on the day's events. Um, I simply wanted to say that I found very interesting certain areas of commonality, most particularly on the issue of good information and honest brokers for information, and a frustration at the lack of context for it. A lack of context for patients and understanding how it is that a clinical trial could look like it's successful, but actually it's just as likely that people were getting well all on their own, but having to understand that, but also for the scientific community to understand that there can be different values, that some people want to keep trying things until it's proven to be a bad idea, as opposed to waiting until it's proven to be a good idea. And that led to the one thing that really did occur to me as I was watching the different kinds of people up here, and it's the need for some degree of trust among the different groups, because I think information is only a beginning, but I think we've seen in other areas across the life sciences, whether it's genetically engineered organisms or it's the vaccine community, that information is a necessary condition but not a sufficient condition for getting everybody together to try to solve a problem, and that the absence of complete trust in the intentions and motivations and honesty of all the different groups that are participating, I think, is a real obstacle. And I'm hoping that this kind of gathering and future gatherings of different governmental officials, as well as interest groups and patients, scientists, might be able to overcome that last obstacle. But with that, I'm going to turn it over to Dr. Cicerone and then have Dr. Feinberg